Tonight, Washington stayed on edge after seeing the first U.S. death from the coronavirus.
The Centers for Disease Control now says 9 people have died from the coronavirus.
The number of deaths from coronavirus in Washington state rising to 13 overnight. 11 of those deaths stem from one nursing home.
29 people associated with this facility have died.
As soon as we saw cases that were taking place in Kirkland, we should have recognized that this is an alarm bell that, is not just, specific to one care facility, but actually has repercussions across the U.S.
There's just an ideology out there that is like, we have to have an economy that works. So someone's going to get sick and someone's going to die.
So here you have a pandemic, which I don't think anybody would disagree is a medical problem. So shouldn't the government, both state and federal, have an infection control physician right by their side at every single meeting, maybe running the meeting? But that didn't happen. Why didn't that happen?
My colleagues and I begged for 3 things. 1, protective equipment. 2, testing. And 3, support, because we need other people to go into those homes when the staff are too sick.
In the span of a month, nearly everybody in the building gets infected, and a quarter of them die from something that could have been prevented.
I'm angry because I believe that Kim would still be here if the proper infection controls were used. I'm angry because I know my sister suffered, and I feel like my sister was looked at as another number and not the person that she was.
All over this country, rural, urban, suburban, everywhere, their long-term care facilities, the places where elderly people are held in congregate, are already creaking under the weight of this thing, and they have no idea what to do. The crisis in nursing home and long-term care facilities will account for a huge swath of the American death toll, unless something is done to address this systematically.
People say anytime you're trying to understand how a system works, to follow the money.
In a healthcare system that is broken, that's very broken, we're trying to do the right thing. And I think we've been underfunded for many, many years.
Something has to change. We are a country that has to change.
Because you can't solve the problem if you don't know how widespread it is. And that's true whether you're talking about a county, a state, a country, even a nursing home.
It's been a very, very difficult struggle, and I will say unequivocally, we have been on our own dealing with this virus and trying to keep our residents safe.
And it just feels like in the richest country on the planet, we ought to be able to figure out how to have a society where people can live to their fullest potential.
Nursing homes have borne the brunt of the coronavirus pandemic in this country.
Nursing homes have been at the epicenter of the outbreak since the very beginning. So is it getting better or worse?
I just always thought my dad was invincible. I never ever thought about my dad not being my dad. I should be able to trust that my dad's doctors and caregivers and these nursing homes that are getting money from Medicare and Medicaid to care for our families are doing the right thing. And I don't trust that.
There is, as yet, no national help for this. There is no national strategy for this. There's no national information about this.
Close to 2,300 Pennsylvanians have died from COVID-19, and half of those deaths have been in nursing homes or long-term care facilities.
We feel like we've been forgotten. The front lines are in nursing homes. So if we don't stop it in nursing homes, we're not going to stop it in hospitals. And so far, the country just hasn't figured that out.
I can't imagine the kind of moment-to-moment fear. It had to be overwhelming.
I think we're all struggling to figure out how it is that our country has botched the response to this pandemic as badly as it has.
We had nothing. And people were improvising because the science was perverted, because the messaging coming out confused people, because we didn't have any national response.
People weren't thinking about nursing homes. They didn't make a big concerted effort to get protective equipment to them, to get, to begin testing staff, to begin anything. The nursing homes were kind of always an afterthought.
We certainly are doing the worst job of any high-income country in the world.
And that is, I can't think in my lifetime, I can't think of any other circumstance where this could have happened, where this response would have happened.
It appears, honestly, that it was all these factors, all at the same time, coming together from very broad national policy decisions that were made maybe decades ago to very granular, small decisions made within the building And that combination, unfortunately, coalesced into the absolute worst case scenario.
This is as difficult as it gets. Every decision we make is life or death.
And we decided that whatever we do, we wanted to be able to look back and feel like we did everything we possibly could.
From the beginning of this crisis, it's the elderly who have faced the greatest risk. Deaths in nursing homes account for a third of all COVID-19 deaths nationwide. What's being done to protect the greatest generation?
The sign of a civilized society is how it takes care of the people who are unable to speak for themselves.